Cognitive therapy is a form of psychotherapy founded by Aaron Beck in the 1960s. The basis of this psychotherapeutic approach is that what we think influences how we feel. In other words, what we think about a situation impacts how we feel in response to a situation. Because cognitive therapy sees the patient's negative thoughts as the cause of a psychological problem, cognitive therapy tries to replace those negative thoughts with new adaptive ways of thinking and perceiving situations. For example, a client may hold on to irrational thoughts such as blaming themselves for the death of a loved one. The goal is to replace negative outlooks with positive outlooks. As for methods, Aaron Beck's technique was to engage the patient in conversation, then gently reveal how irrational they were being. The hope was that the patient would see how irrational they were and change their outlook for the better. Cognitive behavioral therapy is a combination of cognitive therapy and behavioral therapy. Previously in cognitive therapy, only thoughts and feelings were considered in the patient. However, in the cognitive behavioral approach, a patient's thoughts, feelings, and behaviors are connected and impact each other in a self-sustaining cycle. The methods of cognitive behavioral therapy is about the same as cognitive therapy, in which the therapist will attempt to make the patient aware of their own irrationality and hopefully replace negative thoughts with positive ones. One notable treatment in cognitive behavioral therapy was by Albert Ellis. Ellis developed a treatment known as the rational emotive behavioral therapy. Ellis's treatment for psychological distress and maladaptive behaviors were designed to challenge negative thoughts, which he called stinking thinking. Ellis taught his clients to challenge their stinking thinking to lead realistic and flexible outlooks. This treatment is often vigorous and required determination from clients. Two other treatments associated with cognitive behavioral therapy are conversation and relabeling. Through conversation, clients become aware of their own irrationality and change their outlooks, and through relabeling, clients stop thinking of their problems as bad and dwelling on it, and begin to think of their problems as in the past and move on. Cognitive therapy and cognitive behavioral therapy are most commonly used to treat patients suffering from some degree of depression. Doesn't cognitive behavior therapy downplay the importance of the therapeutic relationship? Well, no. Actually, cognitive behavior therapy requires a good therapeutic relationship. Good therapists do many things to build a strong alliance. For example, they work collaboratively with clients, ask for feedback, and conduct themselves as genuine, warm, empathetic, interested, and caring human beings. Doesn't cognitive behavior therapy require clients to be motivated? No. Many clients are unmotivated when they first come to treatment. A part of therapy is helping clients set goals they want to reach, which often boosts motivation. If it doesn't, it's the responsibility of therapists to help patients build motivation themselves. To do this, therapists can gently question clients to discover whether the problem is due to a monetary concern, or perhaps the client feels as if she or he doesn't need therapy, or maybe the therapist is making the client uncomfortable in any way. For additional information regarding cognitive behavioral therapy, you can download a document from beckinstitute.org titled Q&A about cognitive therapy for a description of cognitive behavioral therapy. You can also visit the Academy of Cognitive Therapy website to find a certified cognitive therapist should you have any questions or seek treatment.